Hi, I'm Dr. Freny V Mody. I'm the Chief of Cardiology at the West Los Angeles VA Medical Center and also professor at UCLA School of Medicine. And my invited lecture today was on integrative medicine with specific focus, of course, towards heart disease. So the title was, Is it Hope or Hype? What we basically covered was initially to talk about the rapid intake of CAM medicine or complementary alternative medicine in patients who have cardiac disease, which is as high as 36% and as high as 50%. Most of these patients who have cardiac disease, when they use CAM, are using it with mind-body treatment for stress management, relaxation therapy, etc. Of course, the largest part of CAM is using nutraceuticals, vitamins, etc. And then what I did was I went over the literature on its efficacy. I have to say that I did not cover much of nutraceuticals and vitamins because of time and also because it had been covered previously in other congresses. And there's actually very little evidence on definite, unequivocal benefit. Even with things like omega-3 fatty acids, it is becoming a lot less as time goes on. But what I focused on was the mind-body relaxation therapies that are being used by cardiac patients, and showing that of the literature that I looked at, the one thing that did seem to show unequivocal benefit that I found was transcendental meditation. And it was helpful with respect to hypertension. It was respectful with reducing carotid IMT. It was helpful in increasing the 6-minute walk test in heart failure. And then finally, what I went over was to look at what the mechanism of this mind-body is. And really, I don't think it's as enigmatic as people think of it. It's not mystical. It's all really based on sympathetic nervous system discharge and parasympathetic abnormality, the imbalance of what we call, and the best tool, of course, that we have in cardiology that's used a lot in studying sudden death is looking at autonomic tone, which is with heart rate variability. And so we talked about how heart rate variability was a good way of assessing the efficacy of these treatments. And though we don't have very good data, I think even the transcendental meditation studies were limited in terms of number. The designs were good. They had a good placebo-controlled trial, but they were still limited. And I think that we as conventional medicine practitioners should collaborate to develop this body of literature that is needed for our cardiac patients, since such a large part of them are using it. The other important point that I brought up was that a lot of patients who are using CAM, I mentioned so many people do use it, very few of them actually tell their doctors that they're using it. And that was another important point that was made, that we as practitioners should be proactive in asking them if they're using this, because there might be some that are not helpful and perhaps even harmful, such as vitamin E, which has been shown to be not helpful.